afternoon and welcome to Wellness Series with Lush, a platform where we get in touch with our well-being. You ask for it, today you shall experience it. In our earlier episodes, I had MRI Botswana joining us to educate us and empower us on the importance of first aid, especially during the COVID-19 pandemic. Today, they'll actually show us on how to respond during an emergency situation. Joining us, I have the Medical Director, Dr. Madondo, and the Training Coordinator, Mr. Mokaleng. Dr. Madondo, welcome back.
Thank you very much. I'm happy to be here.
I'm happy to have you. Botswana asked for you to come back and actually show us, because the other time we were just talking about the importance of first aid, especially during the COVID-19 pandemic era.
Good. We hope we'll give some indications on what people need to do in order to prepare for emergencies.
I'm looking forward to that. And Mr. Mokaleng, it's your first time here. Thank you very much for joining us.
Thank you so much, Lush.
All right. Now, with your experiences, we're going to just quickly look at the common conditions that, or common emergency situations that MRI Botswana gets called for. Let's start with bleeding. We have a patient, there's been an accident, or there's some sort of a trauma, they are bleeding. How do we respond quickly and make those seconds count?
Thank you, Lush. There are many areas where people can bleed from, but I think what comes to mind very quickly is trauma. Injury could be to any part of the body, arms, legs, the head, and so on. The principle of treating bleeding in the home setting or wherever you are is applying pressure.
Okay.
So you get a clean cloth, apply it to the wound, and then make sure you apply direct pressure enough to stop the bleeding.
Okay.
But it's not all areas that can be treated by direct pressure.
Okay.
One of the bleedings that I have seen, which has resulted in a catastrophe, is your nosebleed. People bleed through the nose, and someone brings a bucket of water and they pour it on the head and let the blood flow, thinking that it will stop at some stage. This kind of behavior is dangerous.
I've seen that.
Yes. So what one would need to do is to pinch the nose as close up as possible, and then sit upright for about 5 minutes or so, and then let go and see if the bleeding continues.
Okay.
If it has stopped, then don't pick your nose, don't blow your nose, then seek medical help.
Immediately.
I know people who have died because of nosebleeds, because they watched their blood dripping away and hoped that it would stop.
Yeah.
So basically, we're talking about pressure. Even the one on the nose is still pressure. It may not be directly on the bleeding blood vessel, but it's still pressure. So that's the principle of stopping bleeding.
Yeah.
Then
so
you call the emergency services.
Yeah. I love that, because I've seen cases where patients have nosebleeds and they assume this position.
Correct.
How dangerous is that?
That is very dangerous. This is what I've just said, that you need to sit upright and pinch the nose as high up as you can. Obviously, don't pinch on the bone where there's no effect. The soft part, pinch it and breathe through the mouth for about 5 minutes.
Yeah.
While sitting upright, not bending and letting the blood flow.
Yeah.
Usually, it will stop after about 5 minutes, and then you let go and find out if it's still flowing. If it has stopped, then that's well and good. Do not blow the nose, do not pick your nose, and then look for help.
Does it help to apply cold compress?
Not really for nosebleeds.
Okay.
A nosebleed, what we need is pressure, direct pressure. This is why people pour water on the head and think that it will stop the bleeding.
Yeah.
That's a method that doesn't work at all.
At all.
Yeah.
So what I'm taking from you, sit up straight, pinch your nose, pinch it hard, breathe it through your mouth, hold it for 5 minutes, and then assess.
Correct.
Mr. Mokaleng.
Lush.
I've also been made aware that poisoning is one of the common situations that MRI Botswana has been called for. Yes. So what do? We have a situation where a young person or an elderly, they've overdosed, for instance, or a young child has taken a liquid thinking it's water, whereas it's poisonous. How do we respond to that?
Okay, Lush, thank you. Ingestion is one of the methods, like you have just said, of poisoning. Now, what is important is never ever induce vomiting in ingestion, because there is a possibility that you may have the problem where you are trying to vomit and then it goes the other wrong way, then it's going to cause more problems to your respiratory system and other systems.
Yes, yes.
So the most important thing is keep calm with the patient. Make sure you identify exactly what the patient taken, the dose or the amount of what she or he have taken. Then that will be very, very important for you to understand and call for help
immediately.
Yes.
Yes. And make those seconds count.
Yes.
Yeah. Thank you, Dr. Madondo and Mr. Mokaleng, for sharing that with us. Now, Dr. Madondo, last time when you were here, you told us about CPR, chest or CPR for babies and for adults. Today, you're going to show us. Are you ready?
Yes, I am. We will show people how it is done.
Yes.
But just to emphasize that this is not a CPR training, it's a demonstration.
Yeah.
And people should not watch this video and think that they now know how to do CPR.
Yes, yes.
They still need to come for formal training
so
that they do it properly and do not cause harm to their patients.
Definitely. I can't wait. Let's do this.
Yes. Dummy that you can see here, the doll, we call it a mannequin, is what we use for training first aids, so that people can practice what they are supposed to do at home in the event of an emergency. So my colleague here, Mr. Abraham Mokaleng, will show you how to do CPR. In this day of COVID, we normally don't do mouth-to-mouth respirations anymore. We just do what are called chest compressions. And this is what he's going to demonstrate. This is basically to protect people from diseases. So Mr. Mokaleng, you can get rolling and show our viewers how we do CPR, the chest compressions only.
Thank you, Doc. Firstly, I'll start with checking the patient's response. Sir, are you okay? Sir, are you okay? No response. Doc, call 992 and bring the AED for me, please.
Okay, I'm calling 992. And calling the ambulance.
Assess the rise and the fall of the chest to check for breathing. 5 seconds, not more than 10 seconds. No breathing. I'll start on the chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, so that's a demonstration of chest compressions that we would do on a patient who is not responding and is not breathing. We do not advise members of the public to try and check for a pulse, because this is not an easy thing to find. And if you are looking for a pulse, you might actually let the patient die while you are busy looking for a pulse. A few points to note here is that you need to compress the chest with the heel of your hand, and you put the heel of your hand between the nipples or in the center of the breastbone, and then you push down to about 5 centimeters. I know it's difficult to measure. Then the speed is also very important. The speed of compression should be between 100 and 120. And you count like he was doing up to 30. And then if there was someone to give breaths, then they would be giving breaths. But this only happens if we have this gadget here that is used by ambulance people and in hospitals. In this day and age, like I said before, we do not use the mouth-to-mouth breathing. But obviously, we do not expect to find people with this gadget at home. We're just showing you how we prevent ourselves from getting infection by using gadgets that go onto the patient's face, and then we can give them some breathing. This takes some training, and we do not expect this to be used by members of the public. But just to let you know some of the equipment that is available. For members of the public, the only thing that we really encourage them to do is chest compressions only while emergency medical services are coming. That way you give the patient a better chance of survival. This demonstration we have just shown you is for an adult. We will do another one just now where there's a baby involved, and also include a few problems that a baby can have besides a cardiac arrest. Now we have a baby mannequin, and we're going to show you how to deal with choking, and also how to deal with cardiac arrest, just like we did in the adult one. A few words about choking. A lot of people give babies things that they can put in their mouths that result in choking. In my practice, I've seen children choking with bottle tops. Sometimes they are given nuts to eat or sweets. These are dangerous things that should not be given to babies or young children to play with. The babies that we are talking about here are infants that are less than 1 year old. Anybody who is above 1 year, we tend to apply the same techniques that we use on the adults. But with the babies, it's slightly different. So when a baby is choking, usually you can see, because they've got difficulty in breathing, there may be sound coming out, wheezing or stridor. This is a sound coming from the throat because of the obstruction. And once that happens, then you need to help the child relieve this blockage. And Mr. Mokaleng is going to show you what we are supposed to do. I've seen mothers blowing on the forehead of a baby who is busy choking and the baby is sitting upright. That's a dangerous practice. We're going to show you exactly what is supposed to be done. Obviously, we expect you to come for training in order to be able to save real lives. Mr. Mokaleng.
Thank you, Doc. As for a choking infant or baby, what you do is hold your baby slightly slanting down to make sure that the pressure would go down, pushing the object. Then you are going to give 5 compressions on the chest. 1, 2, 3, 4, 5. Remember to support the head. And then slaps 1, 2, 3, 4, 5. Then you change and check if the object is coming out. Then if it is there, you can finger sweep it. Never ever do a blind finger sweep. And then you continue 1, 2, 3, 4, 5. And then you change again, supporting the baby's head. 1, 2, 3, 4, 5. Then if this baby doesn't respond, then it means we are going to do what? The CPR. Now with the CPR, we are going to use, because it's an infant, we are going to use the 2 thumbs. Then you go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
It is important when you are doing the chest compressions using your thumbs, after counting up to 30, you look in the mouth to see if the object has moved into view, where you can now use your finger and sweep it out. If you look in the mouth and you can't see the object, do not stick your finger into the mouth to try and do what is called a blind finger sweep, because you might actually sweep the object further down into the oral airway. Like what I've seen some mothers do when the child is choking is to hold the baby upright like this and go blowing on the forehead like. I think this is an informed sort of action which doesn't help in any way. And if you're holding the baby upright like this, the object is very likely to go further down and obstruct the airway in such a way that it is unlikely to come out. So it is very, very important to understand what you should do if you are to dislodge the obstructing object. It is important to understand the value of first aid. And this demonstration is meant to whet your appetite, to drive you to do training so that you save real lives. You can never be real experts by just watching a video, although it is important to be aware of what trainings are available. So in our training, we train you how to deal with babies, we train you how to deal with the adults, so that in the event of an emergency, you are ready for anything that might come up.
Thank you very much, Dr. Madondo and Mr. Mokaleng. I love how you came in, took over, and empowered our viewers out there. At home, remember, we've spoken about bleeding, we've spoken about snake bites. Earlier on, we also spoke about choking babies. They came in to show us the skills on how to help a patient who probably needs CPR and a child who's choking on some food or a toy or whatever really. The most important thing that you need to remember is the importance of getting professional training. That is why these gentlemen are here for. Mr. Madondo, do you have any last words to our viewers out there?
Yes, thank you very much, Lush. It is important to have some kind of equipment in your house.
Yes.
Our training goes with first aid kits. We have home kits. We have motorist kits. How many times have you come across an accident and you have absolutely no idea where to touch, no gloves, no bandage, nothing?
Yeah.
All these are available, and we advise that at least you should have a basic first aid kit in the house.
Yeah.
And maybe move around also in your car with a motorist kit that has basic things that you use in the event of an emergency.
And you say these are available at
Are
MRI?
very much available and quite affordable as well.
Awesome. Mr. Mokaleng, you handled the baby very well, I must say. As a mother, do you have any last words to our viewers?
Okay, thank you, Lush. My last words, remember, knowledge is power. What we are doing at MRI, we are creating partners in health. I would like to say to people, it's important for you to know what to do when you see an accident. Like Dr. Madondo said, please come and let's reduce situations right now, rather increase saving lives more.
Yes, and make those seconds count.
So much, man. Thank you so much.
Thank you very much for joining me today. I still say this is not the last time I'm seeing you, because that empowerment, like Mr. Mokaleng is saying, it needs to continue on and on and on. Well, to the viewers out there, I hope that you got inspired to take that step and get yourself trained with first aid. I think we can agree on this one. Every household needs to have at least one person trained professionally with first aid skills. Likewise with business centers, schools, everywhere really. So make that step and get yourself trained with first aid. From me, Lush, thank you for joining me. Let's meet again next week, Wednesday.